Johnny,
Yes, Papa.
eating sugar,
No, Papa.
telling lies.
No, Papa.
Open your mouth. Johnny,
Yes, Papa.
eating sugar,
No, Papa.
telling lies.
No, Papa.
Open your mouth. Johnny,
Yes, Papa.
eating sugar,
No, Papa.
telling lies.
No, Papa.
Good day to everyone. My name is Junaid Makabago and this is my report. My report is all about what are the causes of health problem. We have 10 common health issues. Number 1, physical activity and nutrition. Number 2, overweight and obesity. Number 3, tobacco. Number 4, substance abuse. Number 5, HIV AIDS. Number 6, mental health. Number 7, injury and violence. Number 8, environmental quality. Number 9, immunization. Number 10, access to health care. Problem of physical activity and nutrition. Poor nutrition and inadequate physical activity are significant risk factors for obesity and other chronic disease such as type 2 diabetes, heart disease, stroke, certain cancer, and depression. Overweight and obesity. Being overweight or obese increases your chance of dying from hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, respiratory problem, endometrial, breast, prostate, and colon cancer. In-depth guides and practical advice about obesity are available from National Heart, Lung, and Blood Institute of the National Institute of Health. So, ang kailangan gawin dito ay ng overweight and obesity. Tulad lamang ng lack of physical activity. Yes, yung palagi ka na lang natutulog minsan or yung wala kang activity outdoor or indoor lang man. So, and yung kinakain natin na unhealthy eating behaviors, not getting enough good quality sleep, high amount of stress, health conditions, genetics, medicines, your environment. Tobacco is the single greatest preventable cause of illness and premature death in the US. Tobacco use is now called tobacco dependence disease. So, ang sobrang paggamit ng tobacco ay sa sobrang paggamit ng tobacco ay cancer, heart disease, stroke, lung disease, diabetes, and a chronic obstructive pulmonary. So, substance abuse usually means drugs and alcohol. Ito ang katulad ng alcohol, marijuana, inhalant, or perception of medicine such as pain pills, stimulants, or anxiety pills. Yes, yung na-addict na sila sa mga gaya ng mga sleeping pills pag hindi sila makatulog. Abuso sa sangkap, kilala rin bilang pang-aabuso sa droga, ay isang nakapattern na paggamit ng droga kung saan kinukonsumo ng gumagamit ang sangkap sa mga halaga o sa mga paraan na mapanganib sa sarili nila o sa ibang tao at ay paraan ng kaugnay ng sangkap na may sakit. And that's between 11 and 15% of US AIDS cases occur in seniors over age 50 between 1991 and 1996. AIDS in adults over 50 rose more than twice as fast as in younger adults. Seniors are unlucky to use condoms, have immune system that naturally weaken with age, and HIV symptoms. Mga simptomas nito ay overfatigue or weight loss, dementia, skin rashes, swollen lymph nodes are similar to symptoms that can accompany old age. Again, about aging in terms of sexual activity and drug use keep this problem largely unrecognized. That's why seniors are not well represented in research, clinical, drug trial, prevention program, and effort and intervention. HIV is caused by a virus. It can spread through sexual contact, shooting of illicit drugs, or use of shared needles, and contact with infected blood. It also can spread from parents to child during pregnancy, childbirth, or breastfeeding. Mental health. Mental health. Dementia is not part of aging. Dementia can be caused by disease, reaction to medications, vision and hearing problems, infections, nutritional imbalance, diabetes, and renal failure. Mental health condition like drug use, genetics, environment, mental disorder, anxiety, changing jobs or schools, death or divorce. Minsan din para sa akin is yung childhood, then sa school is yung cyberbullying. Yun din yung nagkakos ng mental health natin. Among injuries and violence. Among seniors, falls are the leading cause of injuries, hospital admissions for trauma, and death due to injury. Causes of injury and violence: individual behaviors like alcohol and drug use, or risk-taking, are often connected with factors in the social and physical environment and can increase injuries. The physical environment in the home and community can affect the rate of injuries related to falls, road traffic injuries, and violence. The common types of violence is in the school, like cyberbullying or bullying, child abuse, and trauma. Next is environmental quality. Environmental quality or pollutants can cause health problems like respiratory disease, heart disease, and some types of cancer. People with low incomes are more likely to live in polluted areas and have unsafe drinking water, and children and pregnant women are at higher risk of health problems related to pollutions. Even though pollutions affect all of us, government studies have indicated that low income, racial, and ethnic minorities are more likely to live in areas where they face environmental risk compared to the general populations, and higher proportion of elderly are living just over the poverty threshold. Next, immunization and are among the top 10 causes of death for older adults. Emphasis on influenza vaccination for seniors has helped. Pneumonia remains one of the most serious infections, especially among women and the very old. As immunization through immunization vaccines help develop child's natural defenses to fight vaccine preventable disease. Immunization is best done prior to the exposure of child to viruses and bacteria for which vaccines are available. Katulad lamang ng, I have an example of immunization, katulad lamang ng binabakunahan sila hanggang sa makagraduate sila upang hindi sila madaling magkahawa ng sakit at meron silang tamang pagbabakuna sa kanila. Ang pagbabakuna ay pinakamaligtas paraan upang protektahan ka at ang iyong pamilya mula sa matinding sakit katulad lamang ng COVID-19 at saka iba pa. Next, the last is access to healthcare. Seniors frequently don't monitor their health as seriously as they should, while shortage of geriatricians has been noted nationwide. URMC has one of the largest group of geriatricians and geriatrician specialists of any medical community in the country. So, para sa akin is ang health insurance, health care ay dapat ito ay merong health insurance coverage. Individual without health insurance have less access to healthcare services. According to geographic variation in health, some countries have a mostly private system with healthcare available to those who can pay or afford insurance. Others have a universal or socialized.
Good afternoon, ma'am. Good afternoon, classmates. I'm Judeline Iluciano. My topic is all about what are the possible red flags for an autism child. Some babies take a little longer than others to achieve expected miles from crawling to feeding themselves, and that's not necessarily a problem. Children develop at their own pace, but there are specific behaviors that can be indicative of a developmental disabilities such as autism. Autism can be difficult to diagnose because the symptoms and severity are different for every child. There are a broad range of conditions within the autism spectrums that can impair a child's development and have lifelong effects on their ability to thrive in our complex worlds. I have 3 examples of a red flag of an autism child. Number 1 is your baby has poor eye contact and won't look at you when you are feeding him or her, smiling at him or her. Number 2 is your baby seems unable to understand or use hand gesture, including pointing and waving. Number 3 is your baby does not imitate everyone else's movement and does not seem to notice other people's facial expressions. That's all. Thank you.
Good day, everyone. My name is Gail Marie Mamak, and I am the third reporter of the group. The topic that I am going to discuss to you today is all about autism. Now, what is autism? So, autism also known as Autism Spectrum Disorder or ASD, is a developmental disorder that affects how a person communicates, interact with others, and perceive the world around them. It is called spectrum disorder because it affects individuals differently and varying degrees. So people with autism may have difficulties with social interactions, communications, repetitive behaviors, and sensory sensitivities. However, it is important to note that every person with autism is unique and their strength and challenges can vary greatly. So, autism is a lifelong condition, but with early intervention and support, individuals with autism can lead fulfilling lives. And now I'm going to show you some common signs and symptoms of autism that can include number one, social difficulties. So in social difficulties, with social interactions and understanding social cues. So this can manifest difficulty initiating or a lack of interest in socializing with others. Number two of some common signs and symptoms of autism is the communication challenges. So people with autism can have a delayed or limited speech development, difficulties in using nonverbal communication such as gestures, facial expressions, and there also might be a repetitive or unusual patterns and difficulty understanding sarcasm or figurative language. Now, the third common signs and symptoms of autism that I have here is the repetitive behavior. So, when we say repetitive behavior, people with autism, they will be engaging in repetitive movements or actions such as hand flapping, rocking, um, or spinning object. Now, my fourth signs and symptoms of autism is the sensory sensitivities. So, people with autism heightened sensitivity or aversion to sensory stimuli such as loud noise, bright lights, certain textures, or strong smells. So, people with autism uh, are very sensitive when it comes to their senses. So the fifth and not the last, but not the least, fifth common signs and symptoms is the restricted interest. So developing interest in specific topics or objects, often at the expense of other activities, and they may become deeply knowledgeable in other or in their areas of interest. So I hope that I explained my topic well, and I hope that uh, you enjoy watching my video, and that's all. Thank you.
Good evening, Ma'am Glyza Porcadilla. I am Jairi C. Vendino. So for today's video, I am going to discuss about what are the different types of learning disabilities. So I have six different types of learning disabilities here. First is a dyslexia. Second is dysgraphia. Third is dyscalculia. Fourth is auditory processing disorder. Five is visual processing disorder. And the last one is nonverbal learning disability. So, I discuss first the dyslexia. Dyslexia is a learning disability that affects reading and language processing. People with dyslexia may have difficulty with reading fluency, spelling, and decoding. So, ang dyslexia ay isang kapansanan na nakakaapekto sa pagbabasa at pagproseso ng wika. So, kapag ang isang tao ay may dyslexia, ay maaring nahihirapan sa pagbabasa ng katatasan, spelling, at pag-decode ng mga salita. So, that is dyslexia is a learning disability that affects reading and language processing. So, let's proceed to the number 2, dysgraphia. Dysgraphia is a learning disability that affects writing skills. Individuals with dysgraphia may have struggle with handwriting, organizing thoughts on paper, and expressing themselves in writing. So, ang dysgraphia ay isang kapansanan na nakakaapekto sa mga kasanayan sa pagsusulat. So, ang individual na may dysgraphia ay maaaring nahihirapan sa pagsusulat, pag-aayos ng mga saloobin sa papel, at paghahayag sa kanilang sarili sa pamamagitan ng pagsusulat. So, let's proceed to the dyscalculia. Dyscalculia is a learning disability that affects mathematical abilities. People with dyscalculia may have difficulty understanding and manipulating numbers, performing mathematical operations, and grasping mathematical concepts. So, ang dyscalculia ay isang kapansanan na nakakaapekto sa mga kakayahan sa mathematics or matematika. Ang mga taong may dyscalculia ay maaaring nahihirapan sa pag-uunawa at pag-manipulate ng mga numbers at pag-unawa sa mga concepts ng mathematics. So, let's proceed to the number 2. Auditory Processing Disorder or APD is a learning disability that affects how the brain processes auditory information. Individuals with APD may have difficulty understanding and interpreting spoken language, following instructions, and distinguishing between similar sounds. So, ang APD or Auditory Processing Disorder ay isang kapansanan na nakakaapekto sa kung paano pinoproseso ng brain ang impormasyon sa pandinig. Kapag ang isang tao ay may APD, ay maaaring magkaroon ng kahirapan sa pag-unawa at pagbibigay kahulugan sa sinasalitang wika. So now, let's proceed to the Visual Processing Disorder or VPD. It's a learning disability that affects how the brain interprets visual information. People with VPD may have difficulty with visual spatial skills, recognizing visual patterns, and processing visual details. So, ang VPD ay isang kapansanan na nakakaapekto sa kung paano binibigyang kahulugan ang utak ang visual na impormasyon. At maaaring nahihirapan ang mga taong may VPD sa mga visual spatial na kasanayan. Pagkikilala sa mga visual pattern at pagproseso ng mga visual na detalye. So, number 6. Non-verbal learning disability or NVLD is a learning disability that primarily affects non-verbal skills such as spatial awareness, social skills, and interpreting non-verbal cues. So, NVLD or non-verbal learning disability ay isang learning disability na pangunahing nakakaapekto sa mga non-verbal na kasanayan, gaya ng spatial awareness, social skills, at pagbibigay kahulugan sa mga non-verbal na cue. So, dito po nagtatapos ang aking video. Thank you for watching Ma'am Glyza Porcadilla, and that's all. Thank you.
Good afternoon, ma'am. I'm Jaren Pilumbo. My topic is all about what is ADD and what are the common characteristics. So, what is ADD? ADD is neurological disorder that causes a range of behavior problems such as difficulty attending to instructions, focusing on schoolwork, keeping up with the assessment, following instructions, completing tasks, and social interactions. So, what is neurological disorder? So, neurological disorder, isang sakit sa utak ng isang bata na hindi natin maintindihan ang kanilang pag-uugali. Then, naiiba din sila sa mga normal na mga bata. Number 2, what are the common characteristics? So, we have 4 common characteristics. First, diagnosis. Second, treatment. Third, fear of labeling. Fourth, a word from very well. So, first, diagnosis. If you suspect your child has ADD with or without hyperactivity, talk to your child's school counselor, teacher, physicians about appropriate treatment. So, what is hyperactivity? So, hyperactivity means a person may seem to move about constantly, including in situations when it is not appropriate, or excessively forgets stops or talks. In adult, hyperactivity may mean extreme restlessness or talking too much. Number 2, treatment. ADD is sometimes treated with stimulant medications such as Ritalin. In some cases, stimulant medications can help students with ADD stay on task and focus. However, some stimulant medications have been associated with serious side effects. As a result, many parents hesitate to use Ritalin, Adderall, or other medication to treat ADD. Number 3, fear of labeling. Some parents are frightened that if they have their child tested for ADD, she will be labeled as a parent. However, you can do a lot to prevent this from happening. It's important to talk to your child so that she knows she's not doing anything wrong in struggling with ADD. But instead, that is it up to you as a parent to help her learn that skills that will help her learn as easily as possible given her unique makeup. Number 4, a word from very well. A diagnosis of ADD, this means you are committed to treating your child with medications. As you may be led to believe based on how prevalent this has become, there are many different approaches involved in treating ADD, only one of which is medications. Early interventions can prevent the disorder from taking a detrimental toll on a child's life. Thank you.